As the first clip in this segment illustrates, communication themes have been purposefully woven throughout course modules. Module 5 focuses specifically on communication. It uses a series of specially designed reflective videos to trigger reflection and discussion. The focus of this module is on learner reflection and discussion using a set of prepared questions and prompted pause points to support critically reflective practice. The videos are ill-structured by design, reflecting poor and better, but not ideal practices. Each segment has a set of concluding teaching points to help summarize key messages.
And by the way, if you're starting a patient on an opioid, bring them back the next day or 2 days later to readjust the doses, or phone them. Don't write a prescription and say to them, come and see me next week or in 2 weeks' time. Because one of the principles of pain management is titration, adjusting the dose to the right dose to get the effect. Okay? And you can do that quicker with the short acting. And then the long acting formulations, the OxyContin, Hydromorph-Contin, Codeine-Contin, MS-Contin, MS-Lon, is generally reserved for patients who are now stable, they're doing well, and then you switch into a controlled release formulation. Okay, so that's generally the rule. There are always exceptions.
Anything else?
If he was going to start talking about bad news like that, maybe it would have been helpful to have another family member there.
That's right. Where was the guy's wife? Was it his neighbor, his son? He mentioned a kid. You know, that's right. Now, it's pretty awful. What would you have done? Anything that you can think of that you might have done to improve things? I think first of all, we'll sit eye to eye. And we'll ask, how are you feeling? And that would be a nice thing to say, wouldn't it? Anything else?
Pain.
Yes, that's right. And what's that doing? That's showing an interest in the patient, isn't it?
And also to get a sense of whether that's going to be a good time to talk about stuff. I mean, if he's nauseous or he's in pain, then I mean, sort of like, that's not going to be the...
Absolutely. You can't talk about touchy-feely stuff if somebody's in pain. And the other thing is that I feel sorry for the patient, but I feel very sorry for that doctor. Because, and that's sometimes that we have to recognize that.
Yeah.
You know, these nasty bad surgeons and nasty bad cancer doctors who don't tell people, they're not all good at it. And they don't know what to say. You know, like Buckman's book, I don't know what to say. And sometimes they're not. And sometimes the pastoral care people don't do it, because just because you're good at weddings and funerals doesn't mean you're good at talking to people. What about that bit where he said, I think I'll get better and I'm going to beat this? What do you say when somebody says that? When you know a miracle may happen and it's unlikely. What? Do you have anything you say? It's not fair. Is that how you're feeling? And that's okay for us to engage in that. That's not stepping over that invisible line where we cease being helpful.
This scenario illustrates that a family physician, nurse, or other member of the care team is often involved with the patient after they have had information from other providers. Presuming a patient has the same understanding of the illness as the care provider.
Anything else that you might do? Everybody here would do better, I know that.
Shake hands, just touch.
Shake hands, that's right. Maybe even hold his hand if you know him well enough and you have permission. Know him well enough and have permission. Okay. Anything else that you would do?
Some of the medical terms he was using symbol forms too.
Medical terms, I know. We talk in that all the time, don't we? Yeah, we could have a conversation, you and I, using letters of the alphabet without using the word. PRN. But anything else? That was a very good one, though. That was very subtle. I don't know if we did this today, but that was really good. So what would you do better? What would you do? I'll explore this, shorten the breath a little bit, ask him some more questions about that when he gets it.
Yeah.
Long last.
Exactly. So you want to find some of the medical aspects we're even missing. You know, does it happen when you lie down? What's that? Does it frighten you? What does it mean to you? Because things mean things to us. And they mean sometimes different things to patients, you know. And sometimes when they're telling you something, you know, oh, I have a pain here, doctor. What does that mean to you? Is a question, as well as how often, what type of pain, what helps, what makes it worse. What does it mean? So the meaning of that shortness of breath. And to him, it probably means his heart isn't working very well. So yeah, that's right. Anything else that the doctor could have done?
I don't know if there'd be enough.
Pardon?
Update a bit with the medication.
Yeah. Look at the medication and whatnot. Also, he said he thought he was never going to get out of hospital. Wow, was that ever something asking for a segue? You know? What about that? What did you mean by that? And probably he'd go on to say, I thought I was going to die, or I thought I was going to be in the transplant list, or something like that. You know, there was something going to happen from that. Anything else that...
Actually, she could have spoken, asked his wife how she was doing.
Very good point.
You know, it's like, she's having to live with him declining.
Yeah. And heart failure is very difficult to deal with because, you know, the patient will do well and then they'll regress and then they'll do well again. And so it's a roller coaster, an emotional roller coaster for both the patient and obviously the wife. So that's something that has to be addressed as well. Yes, Julie? Anything else?
I think if this was his first visit after the hospitalization, she might have scheduled a little bit of extra time and actually talked about what may happen in the future and talk about end-of-life issues.
Right. Yeah. And that was a beautiful time to do it when he said about the hospital, he thought he'd never get out, and on you go into the end-of-life issues.